we have done CBC, in which the HB was 10.4 gram per deciliter, as it was shown by the pallor positive in the general physical examination. The total RBCs were 4 million, MCV was 88, neutrophils 56%, lymphocytes 25%, monocytes 4%, and there was a mild eosinophilia with 15%. Among the inflammatory markers, we have done ESR, which was raised, and and serum CRP, which was also raised. Among the baseline, the serum LFTs were normal, serum renal function tests were also normal, and urine complete was normal as well. Among the specific investigations, the rheumatoid factor, RA factor was positive, and serum anti-CCP was also positive. In this following patient, we could not arrange an X-ray, but we can also go for radiological investigations in which we can find the typical rheumatoid features in X-rays of the particular joints which are currently affected. On the basis of history and examination, we made the differential diagnosis. The first differential diagnosis we put here is rheumatoid arthritis due to the typical features of rheumatoid, but in differential diagnosis, we also put psoriatic arthritis as well. In psoriatic arthritis, the joint pains are usually similar as that of rheumatoid, but there are also skin manifestations. But some of the times we can miss the skin manifestations, such as if the psoriatic rash is in the scalp, which we cannot see, or if the patient has psoriasis but he does not mention it in the history. So we can miss the psoriatic arthritis and we can label it as rheumatoid. So we have to rule out the psoriatic arthritis. We have put systemic lupus erythematosus SLE in differential diagnosis also, because it can also present with joint pains. But as we probed into the history, there was no history of hair fall or photosensitivity and other features of SLE. So we can easily rule out SLE, and there was no rashes in this patient and no history of psoriasis. So psoriatic arthritis was also excluded in our differential diagnosis, and with the investigations we have done, we have concluded that our final diagnosis is rheumatoid arthritis.